Hi there, I'm Dr. Sievert K-D. Let's talk Botox, but for your bladder. There are no wrinkles involved, but there's a lot to love about how Botox can make you feel. Let's review what bladder Botox is and what to expect before, during, and after the procedure. At the end, we'll review some common questions and their answers. Bladder Botox injection is a procedure where a medication called OnabotulinumtoxinA, or Botox, is injected into the wall of the bladder. The purpose of the procedure is to get the medicine directly where it's needed, the overactive muscle of your bladder. The goal is to achieve improvement in your symptoms like urgency, frequency, and incontinence episodes. Usually your muscles receive a chemical signal from neurotransmitters released by nearby nerves that tell them to squeeze and contract. Botox works by preventing the release of neurotransmitters from the ends of your nerves into muscle. Simply put, it just means that Botox-treated muscle stays relaxed because there is less of a signal telling it to squeeze. You may be familiar with Botox being used cosmetically to minimize the appearance of wrinkles and to treat headaches. We use the same medicine here, but apply it directly to the bladder. When overactive bladder has not responded to oral medications, Botox is a well-studied, FDA-approved option. Studies show that after treatment, urinary frequency improves by 30%, urinary urgency by 40%, and incontinence episodes by 60%. Best of all, nearly 25% of patients are completely dry after treatment. The most serious risks of treatment in about 10% of patients is difficulty urinating, requiring self-catheterization. This may need to be continued for about 3 months until the medication wears off. With bladder instrumentation, there's also a risk of a urinary tract infection. We minimize this with clean instruments and an antibiotic dose on the day of the procedure. Before your procedure, you'll need to stop all blood thinners at least 5 days before. One exception is baby aspirin, which you can continue taking. Leading up to your appointment, if you experience any burning when you urinate or any symptoms of a urinary infection, call and let us know. We'll need to test your urine and likely reschedule. The procedure is done in the office with local anesthesia. It's generally a 1-hour appointment, and because you're not going to sleep, you can come by yourself and drive afterwards. For your first Botox injection though, I'd recommend coming with a buddy. When you arrive, we'll have you urinate to empty your bladder, change into a gown, and position you lying on your back on the exam table. Next, we'll place a small catheter in your bladder, first to check how much urine you have left over, and to give you a numbing solution that includes lidocaine. Then for 20 minutes, you get to marinate, as I like to call it, as the medication settles and you start feeling numbed up. During that time, feel free to relax, bring a book, or scroll through your phone. After that, we'll position you and get started. I'll drive a camera through your urethra into your bladder. Through the camera, I'll pass a needle that I'll use to inject the medication into the bladder wall. I'll spread out the medication in a systematic fashion to deliver it to the most sensitive parts of the bladder. This will take no more than 5 to 10 minutes. When finished, the camera comes out, and by then you'll need to urinate again. We'll let you take care of business and get dressed. Once you've urinated, you're ready to head home. After the procedure, we expect you'll experience some discomfort urinating and see blood in the urine for the next 24 hours. Generally, this resolves quickly and can be managed with some over-the-counter Tylenol and ibuprofen. I take it easy once you get home, but you can go back to all of your normal activities the next day. In addition, I may send you home with 1 antibiotic tablet to further minimize the risk of a urinary infection. The medication itself will take 7 to 10 days to kick in, and it will reach its maximum effect in about a month, so be patient as it starts working. For follow-up, we'll see you back in about 4 to 6 weeks. We check to make sure your bladder is emptying well and review your symptoms. More often than not, we take this opportunity to celebrate your incontinence improvement together. At this point, you probably have some questions. Let's go over some common ones and get you some answers. Question 1. If Botox is a medicine, why can't I take it as a pill? Because the active molecule is so big, it can't be absorbed as a pill that you ingest. Its size has another advantage because it stays where we inject it and it doesn't travel to other parts of the body and have effects elsewhere. Question 2. How long does bladder Botox last? On average, it lasts around 6 months, and most patients come in twice a year. However, it can last for up to 1 year. Question 3. Can Botox cure my incontinence? Sadly, no. The Botox helps us manage your condition. Once it wears off, like other medications, your symptoms will return and will need to repeat the injection. The good news is studies have shown the medicine continues to be effective again and again, so there's little worry that your body will get used to it and the medication will stop responding. As a reminder, my team and I are always available for any questions or concerns that you have. Let us help you decide if Botox is the right medicine for you. Again, I'm Dr. Eur Urol, and until next time, be well.